Gender dysphoria in children, talking and supporting your child through psychological challenges. Hello dear parents. Today, we will discuss a topic that may be sensitive but is incredibly important in the parenting journey: your child's gender identity. When a child feels that their gender does not align with the sex they were assigned at birth, it can cause confusion and anxiety for both the child and their parents. In today's discussion, we will cover the following key points. First, how to recognize signs that your child may be experiencing distress or discomfort related to their gender. Next, we will explore how to start an honest and open conversation with your child about this topic. Finally, we will discuss the most practical ways parents can support their child and when to seek professional help. Let's embark on this journey to understand your child together. What is gender dysphoria? First, let's explore an important concept your child might be facing: gender dysphoria. Simply put, gender dysphoria is the distress or anguish a child feels when their gender identity differs from their biological sex assigned at birth. This distress is not just a fleeting thought, it can deeply affect their studies, relationships, and daily life. It's important to note that not all children with diverse gender identities experience this distress. Many feel completely comfortable and confident in their true selves. However, some children genuinely struggle with gender dysphoria, especially when facing bullying, stigma, or discrimination from their environment, such as at school or in society. Signs of gender dysphoria in young children. So, how can you tell if your young child is experiencing gender dysphoria? Sometimes the signs are subtle, but with close observation, parents can notice them. Let's look at some key indicators. Your child may strongly insist they belong to a different gender. For example, a boy might repeatedly say, "I'm a girl, not a boy." They may show discomfort, frustration, or anger when referred to as boy or girl, brother or sister, based on their biological sex. They might ask you to call them by a different name or use different pronouns to reflect their desired gender, such as being called he instead of she, or vice versa. You may notice signs of anxiety, such as declining school performance, irritability, or loss of interest in daily activities. These signs may be more pronounced in gender-segregated activities, like school sports. Another sign could be related to bathroom habits. For instance, a biologically male child identifying as female might sit while urinating. Your child may ask innocent yet profound questions about their body, like, "Mom, will this part of me turn into a girl's part?" Or, "Can I grow up to be a dad instead of a mom?" They may express clear discomfort with body parts associated with their biological sex, even wishing those parts would disappear or change. They might say things like, "I wish the doctor would take this part away," or, "I don't want my chest to grow bigger later." Signs of gender dysphoria in adolescence. As children enter adolescence, the signs of gender dysphoria may become different and sometimes more complex. During this stage, they become more aware of their body and society, which can intensify their struggles. Parents should watch for these signs. Your child may strongly express that their gender identity differs from their assigned sex at birth. They might confide that they don't feel confident or comfortable with their current gender. They may wish to eliminate certain gender-specific physical traits or desire traits of another gender. For example, they might research or mention using medications to appear more masculine or feminine. They may also wear loose clothing to hide their body's contours. Like younger children, adolescents may request to be called by a different name or pronouns that align with their gender identity. More concerning, they may engage in negative coping behaviors, such as smoking, drinking, or withdrawing and cutting off communication with others. Some may self-harm, such as scratching, cutting, or biting themselves. They may show signs of depression, like losing interest in favorite activities, struggling with sleep, lack of focus, or unpredictable mood swings. If you notice these signs, parents should seek professional psychological support for their child and avoid self-diagnosing. Talking and supporting your child. The role of parents. Once you've noticed these signs or simply want to connect more deeply with your child on this topic, starting the conversation and offering the right support is crucial. So, where should parents begin? If you sense something is unclear and want to proactively understand, try starting gently. You could ask your child about their feelings regarding their gender. For example, say, "Bin, how does it feel to be a boy?" Then follow up with, "What would it feel like if you were a girl?" Don't worry that this will plant ideas. If your child is grappling with these feelings, such questions can unlock their true thoughts. If direct conversation feels challenging, try reading a book or watching a movie with gender-diverse characters together and use it as a conversation starter. If one day your child musters the courage to confide in you, it might feel like a shock. But remember, for them to share this, they've likely been wrestling with it internally for a long time. Their choice to open up to you is a sign of trust. In such moments, the most important thing is to show unconditional love and acceptance. Hug your child and say, "No matter what, we will always love you. We're here to listen to everything that's worrying you. We'll figure this out together." Listen to understand what your child has been through. You might ask, "How long have you been feeling this way?" Or, "Have you talked to anyone else about this?" Ask what they need from you. A simple question like, "What do you want us to do to help you right now?" shows respect for their needs. If they want to change their name, pronouns, or clothing, support them. This can reduce their anxiety and build their inner strength. A critical note: never try to change your child's thoughts. This can deeply hurt them and prevent them from being their true selves. Children who feel unaccepted by their families are more likely to withdraw, experience anxiety, gender dysphoria, or even depression and other negative behaviors. When to seek professional support. Sometimes, parental love needs the support of professionals to help your child through tough times. How can psychologists assist? Trained professionals can support the entire family. They will first conduct a comprehensive assessment of your child's physical and mental health to provide the most suitable support. For pre-pubertal children, professionals can provide information to help families understand and support their child better. They will also work with the child to help them understand their gender identity and affirm themselves safely. For adolescents, therapy can help them explore their gender identity more deeply, and family therapy can help parents better understand their child's experiences. Professionals can also help your child develop communication and social skills to live authentically. Parents, please remember that therapy is only effective with your child's consent. Forcing them to see a professional can worsen their distress. Be patient, talk to them, and encourage them to understand that professionals are there to help them feel better. This journey may not be easy, but with unconditional love, patience, and an open heart, parents are the safest and strongest haven for their child. Thank you for listening.